for impressive presentation. The session for question will be open after all three presentations, and now I want to invite the representative of the European Commission, Head of Sector Public Health, Directorate General for Research and Innovation, Dr. Barbara Kerstiens. Please, the floor is yours.
Thank you very much, and I would like to thank the organizers as well for having invited me. Peter presented you with data that are a result of research, and research can have an important contribution in helping improve our health systems. And what I'm going to talk about today is about looking for innovation, and innovation documented through research for health systems transformation. The first slides will describe you a situation that you're all very familiar with. We spend a lot on our healthcare, and health and social work accounts for 10% of overall employment. But health contributes to overall employability by enhancing the productivity of the workforce and offering quality job. And also, health investments serve as an effective safeguard against poverty. So in our investment, we better get it right. And currently, our health systems are under stress. Health spending is growing at a faster pace than GDP, and you know all the factors and drivers for these increases. As was mentioned this morning, in various areas in Europe and beyond, health inequalities are rising. So there is definitely a need for transformation to ensure the cost effectiveness and sustainability of our systems, as well as to guarantee access to high quality care. Now, when I talk about health systems transformation, what are we looking for? Well, the first thing is, through better health promotion and disease prevention, have fewer of these so-called chronic patients. We want more simple, personalized, cost-effective technologies and treatments. We want a better integration of the healthcare that we provide. And we want the services to be more focused on the patient and putting the patient at the center. Obviously, we want safety, quality, but also to guarantee the continuum of care, which is sometimes very difficult to achieve. And then, what we come faced with the challenges we have, we definitely need a diverse but skilled health workforce. So, investing in the right research to try to see how we could achieve all of these goals might pay off. Now, what are the opportunities for transformation in our health systems? Well, first of all, the health sector has a high potential for innovation and competitiveness. As I mentioned, we already have, but we could broaden it, highly skilled and workforce. We have some of the subsectors of the health sector that are innovation-driven, like pharmaceuticals, medical devices, and equipment. E-health is a very important element that will play an increasing role in the future. In the health sector, we can and should capitalize on innovations from other sectors. ICT is an obvious one, but nanotechnology, and you may mention many others. And for innovation, we should engage with a citizen that is more empowered. Now, talking about research and the role that research could play in helping systems transform, I would like to point out to the opportunities that will come up under Horizon 2020, and most of you are familiar with it. It's a new research and innovation framework program from the European Commission, from the Union. So that overall framework program, and I won't go into the details of the overall program, but basically there are three building blocks: excellent science, industrial leadership, and societal challenges, meaning that the research that would be funded at EU level is also meant to help address some of the challenges that our societies faces, and one of them being health and well-being. Now, Under Horizon 2020, we have the challenge called Health, Demographic Change and Wellbeing. So it's a funding stream to fund research that tackles the challenges to achieve health, demographic change and well-being. And what we're aiming for is that to better translate science to the benefit of citizens. A lot of research has taken place, but maybe sometimes the benefit to the patient was not immediately obvious. We would like to be funding more action-oriented research. So test and demonstrate new healthcare models, new approaches, new tools. You are all familiar with the endeavors of everyone here in the room and beyond to promote healthy and active aging. But also we would like, through the research, to improve health outcomes and reduce inequalities. And, which is a slightly different aim, it helps support a competitive health sector, meaning that we support also the small and medium-sized enterprises that can play a role not only in improving the service delivery, but also represent economic growth, or could represent economic growth in Europe. Now, Horizon 2020 will start from the 1st of January onwards, and as far as the health, demographic and well-being challenge is concerned, I would like to present you some of the general approach we take. First and foremost, we would like the funding to really highlight the EU added value of the research. So, research that capitalizes on the diversity of our health systems we have in Europe. We also will go much more than was done previously on cooperation between multidisciplinary and multi-sector teams to how to address the challenge. You will see that we more upfront, so to speak, ask for patient organizations, policymakers and other end users of the research to be involved in the design and the evaluation. The trend that was already growing on the previous framework program, the partnerships, whether it be public-public or public-private, and international collaboration will continue, meaning that it's only being together and partnering it together that we can probably achieve more. And then we will support the full spectrum of research, from research to innovation, so really getting from what is classically said, from the lab to the bedside, but it's really moving from the fundamental research to the implementation research. We will be looking for an integrated approach to address key research challenges. And here I presented some of the challenges in the research itself. So breaking the barriers, speaking the same language, the need for capacity building. In order to generate the right knowledge, we might need to generate better tools. Some of our research methods and tools are not up to addressing the challenges that exist currently, the new technologies that we have, and we need to apply them in health research and public health research more specifically. What some of our stakeholders have told us that we have been, in our past research, underestimating or undervalue the economic aspects linked to health services reorganization, transformation. And we will be asking for more comparative effectiveness research, but also looking at different measures to assess economic impact. And then another challenge is the research is done, all good and well, results are important, but how can we make sure that policymakers or relevant end users of the research will pick up on these results and do something with it? And we feel that at the union level there's a role for us to play, but we think that the research community itself has a role to play by reaching out to policymakers or involving them, like I mentioned before, from the start. So I was referring to innovation as a support to health systems transformation. And innovation is trying to do something different, something new, to achieve better results. But it means also that we looking for innovation in research itself. And it's also innovation within, might be, translate to innovation within the research community itself. Because doing things differently requires a change of mindset. Working in multidisciplinary, multi-sector teams is not easy to do. And that as well asks for a change in mindset. Then we might need or might not need a bit more of an entrepreneurship. And we need more and better information on innovative approaches. And especially when we talk about health systems, we need to strengthen the trust between those that provide the services and those that seek to use them. And as an example, the whole e-health, m-health area is something where the issue of trust between the provider that collects the data, or one of the entities that collects the data, and the patient or the citizen that provides the data, needs to be established in order for these data to be well used. So I was going to say that as from today onwards, theoretically, if all works well, our first work program covering 2014-2015 will be put online. You will find it on the participants portal. It's what we call an orientation paper, meaning there might be slight changes, but it gives you a gist of what we're looking for. The official publication is still aimed for December 11th of this year. And I would like you all to invite you all to participate and come up with your ideas for innovation as support to health systems transformation, especially because contrary to what was done maybe in the past under the framework programs, the topics you will find for research are left very broad. So it's up to the research community themselves, the researchers themselves, to say, well, I think that this would be relevant research to do to address this particular challenge. Thank you.